Post-operative instructions after tummy tuck surgery. See, immediately after surgery, when you're coming out of the anesthesia and you're coming to the room, you feel a lot of tightness in the tummy. That is very much expected because we tighten your tummy muscles so much so that you feel very much tight tummy. And same way, when you are coming out of the when you are coming to the room, we'll keep you head elevated, as well as we keep some pillows under your knee joint. That is to give a less tension to the suture line, because we pull the skin and stitched it. Obviously, we have to give a less tension to the suture line. So, some urinary catheter will be there in few patients if the surgery is little prolonged. That will be removed immediately when you are coming to the room. Maybe after an hour, we remove the catheter, and there will be a drainage tube coming out through your pubic region. So that might hurt you when you are walking and when you are moving around. That might hurt you. So that will be removed after 24 hours. Say example, if you are coming for a surgery today, next day morning or afternoon we remove the tube completely, and after that you can go back home. See, initially you won't feel much pain because we given a nerve blocks and the rectus sheath blocks, so that you won't feel much pain except the discomfort of the tightness. And you will be started on oral fluids and 4 hours, 3-4 hours after surgery, and you can have a normal healthy diet post-operative period. It take a lot of fiber-rich food, vegetables, fruits, and protein-rich foods. Don't take carbonated beverages or a junk food, because you have a tendency for a constipation after surgery, because we give a lot of painkillers, and you also don't move much. So all those things lead on to a constipation. Sometimes we put you on some laxative medications, laxative syrups after the surgery if you have a trouble. And when you're going back home, you have to bend and walk for a period of 10 days. Okay. Because we pulled and stitched the skin, we don't want you to stretch it by making walking straight. So you have to bend and walk for the period of 10 days. And same way, you should not put your like some people have a habit of sleeping face facing down. So that gives a directly pressure over the suture line. You should not do that for a period of 10 to 15 days. And even turning to one side, better to avoid, because if you turn to one side, swelling goes and settle in the different area, so you feel uncomfortable, and then your pain will be more in that area. So you have to lie down straight, head and elevated. And same way, when you even at the home, when you are lying down, keep 1 or 2 pillows under the knee joint, and as I said, head elevation, and the knee has to be kept with the pillows supported, so that the pressure to the wound will be less. And post-operatively, when you need to inform us, as I said, there will be a severe pain in particular area, and very hard to touch and very red in that area. You have to immediately inform us. And high fever, you have to inform us. More than 101 degree Fahrenheit, you have to inform us, because there might be an infection. And shortness of the breath. So sometimes the pulmonary embolism, very rare instances, might happen. Because of that, you have to inform us when you have developed shortness of the breath or extreme tiredness, because your blood loss might be more, so you might need a blood transfusion. So we have to check your hemoglobin when you're coming for the follow-up. So these are all the warning signs you need to be aware of. Resuming back to the work, see, we want you to walk as much as possible, not overstrained, but inside the room, going to the toilet, because we want you to move your calf muscles often, because to prevent the deep vein thrombosis and pulmonary embolism complication. We want you to, in fact, you walk immediately after surgery. That means after 2-3 hours we make you walk. Okay, then only we can prevent these complications. And driving, I advise strongly 1 month don't drive the vehicles, because sometimes you'll be on painkillers. Even the sudden movements might be a disturbing thing for your wound. So 1 month no driving the vehicle, and 2 months no heavy workouts. 2 months, because if you do workout, the scar tends to stretch and gives a it might widen, so that scar won't look good. So 2 months no heavy workouts, and going back to the work, maybe 15 days to 20 days you can resume your office work. But if you work from home, even a week after you can start doing the work from home. Even sexual activities you can resume after a month. Showering, when I can take shower? See, usually third day you visit us for the plaster removal, third or fourth day, because you leave the hospital on the first day after 24 hours, and you come back after third or fourth day for the plaster removal. We remove the plasters and put you on the garment. The garment is a tight fitting dress to reduce the dead space in that area and give support to the skin. So that the third day after you come to us, you can take shower. We usually cover the wound area with the water resistant plasters, so that you can take shower from as soon as you go back from the our clinic. And daily you take shower, and seventh, eighth day you come back for the suture removal around the navel and around the some interrupted sutures. We put it in the main suture line also. So we remove all the sutures at eighth day. So after eighth day we can leave the wound open, and we can apply some ointment for the better healing. See, in tummy tuck, lymphatic drainage massage can be started after 2 weeks, not so early like a liposuction. Here we can start after 2 weeks, and every week 2 sessions of the lymphatic drainage massage is advised. You can come to our center. Our sisters will help you and train you for the lymphatic drainage massage. After 1 or 2 sittings, probably you can do on yourself or ask your assistant to help you for the lymphatic drainage massage. We will prescribe you antibiotic and painkillers for a week, and after that, even immediate post-operative period, we put you on arnica and high dose of vitamin C for the period of 2 to 3 weeks for the faster healing and swelling reduction. So for each patient, these medications might vary, but you have to strictly follow our instructions as advised in the drug sheet. The final results will be visible after 2 to 3 months. Till that time, please be patient, and you will get a good results. Don't worry.